And there are other services within the
A
program
licensed
as well,
social worker
besides
provides
nursing.
support for the
So
patient
even
and
if you don't
family
have a nursing
and
visit
helps the
every day,
family identify community resources to respond to the needs of
the
their
team
loved
works
one.
very closely together, so they'll tell each other, if there's anything new going on.
We have social workers that can help
So,
with resources within the community to allow that patient to stay in their own home, whether it's Meals on Wheels or Lifeline, so that the patient is safer alone in their own home. Then we can help set those services up for the patient.
So you can go with a clear mind and know that Steve's got someone with him.
Oh, that's wonderful.
Good.
That
The
would
social
be
worker's
helpful.
role is also to make sure that people have the support they need in coping with the changes that are happening, both physically and emotionally.
There was one time that I recall that my mother was taking her medications inappropriately and was very confused, did not want to be told what to do. And my dad was trying to help her, and she was resenting my dad, and I was trying to be involved, and it was just a very, very stressful, tense situation for all of us. The home care nurse came that day, and I happened to be there with her, and she said, let me give the social worker a call. And she was there within just probably 10 minutes, and we were able to sit down as a family with the nurse and with the social worker, and the social worker was able to come up with a solution for all of us, and it just made such a difference just in our relationship from then on.
Yes, Dr. Smith. I'm one of the nurses here at the hospice house, and I'm calling on behalf
The nursing staff works in concert with the patient's personal physician and coordinates the various aspects of care necessary to make each patient as comfortable as possible.
orders and medications. At this time,
what they did for us was they took on the responsibility of dealing with all of the details of caring for someone like this. If we needed medical advice, they provided it. If we needed medicine, they provided it. If we needed equipment, they took care of it. All I had to do was call them, and they were there.
The doctor will take the calls from the hospice nurse, so they don't have to be waiting for that call back. And for many people to know that that nurse is available to answer questions and address concerns.
We'll get back in
You can
touch
just
with
see
you
their
if you-
shoulders relaxing and them starting to feel the relief of knowing that they have a new kind of support that will be there for them.
I brought something for you that Dr. Miller suggested.
If the goal is to keep the patient at home, then the hospice team provides education and training to empower the family to provide the needed care.
How to use it. He's ordered a nebulizer. This is the medication here. Mm-hmm. Snap the top off.
That top right there just breaks.
Break it off, twist it off.
The nurses gave us instructions on how to best care for her and things to look for as the disease progressed. And we were able to work with the nurses in learning those techniques and then be able to care for her during the rest of the day while the nurses weren't there. But if circumstances ever changed or there was a new situation that arose, we had no problem of calling them immediately, and they would come and help us to find a way to make her comfortable again.
One of the nice things about hospice is that the hospice nurses are available to you by phone 24 hours a day.
Since questions about care can come up or conditions change at any time, Seasons Hospice has nurses on call 24 hours a day, 7 days a week.
Isn't that a nice thing to know?
It's so reassuring
Right.
to know that you can make a phone call and somebody will be there that could help.
When the nurses first came, met with the family to find out what our situation was and our needs, they took time to get to know the family, and especially Kay. And as they talked with my wife, they asked her, what 2 characteristics that will best describe you? Kay just kind of shrugged her shoulders. And one of the nurses says, well, I sense in you strength of character and humility. And at that point, I kind of knew that they were there to help me, make her as comfortable as possible. And not only then, but it continued on where they got to know my family, my mother-in-law, our 6 children, and became friends with us and were available whenever we needed them.
The nursing care at Seasons Hospice is one of the highlights of hospice care. The nurses are so caring. In addition to caring physically for my mom, they were just like friends to her, and they showed such interest in her life and our family. The care was absolutely fantastic, 24/7. I asked her which was her favorite nurse. She would say, every single one is wonderful.
I just am so amazed at how professional and friendly and helpful they are. I've just been so pleased with their openness to talking to me when I have something that I need to bring up. They just, I can't imagine a better setting than where I am now.